A bill that could change who is allowed to prescribe mental health medications in Vermont is now moving forward.
Supporters say this could really help expand access to care, but psychiatrists warn that it could come with some risks. NBC5's Charlotte Hancock is live in the newsroom now with details. Charlotte.
Well, this bill has been debated for years. It has passed the House and the Senate, and it is now moving on to the governor's desk. Act 237 would allow doctoral-level psychologists in Vermont to prescribe certain mental health medications.
This bill is not an effective way to address the mental health access needs of Vermont. It's not cost-effective, it's not very safe, and frankly, it's dated.
Supporters say with additional training, psychologists could help fill gaps in care, while opponents have concerns about safety and training. The legislation would require a certain amount of training and a collaborative agreement with a psychiatrist.
To have a psychologist with this particular kind of training really allows for a more whole, sort of fully rounded care, so that the psychology, the psychotherapy, the talk therapy is prioritized.
Officials with the Vermont Psychological Association say that could allow patients to get both therapy and medication from a provider they see regularly.
Look at the training that psychologists who have doctorate degrees take. Look how much education they have about brain science, neuroscience, psychology. Look at that. Look at the training that is required by the bill.
But some argue that training does not match the complexity of these medications.
The training is so much less. Psychiatric medications are not just something that affects mood. They're active in the brain. They're active in every cell in the body.
If signed into law, the change would take years to fully implement as the state works out how the program would operate. Governor Scott told reporters today that he hasn't looked at the bill yet, but he is not opposed to it. He has a few more days to decide if he wants to sign it or not. Live in the newsroom, I'm Charlotte Hancock, NBC5 News.